What is going on, guys? This is Dr. Ryan Garner with Apothecary Wellness. Today we have ZJ. He is a 39-year-old male. He has a history of ADHD, major depressive disorder, sleeping disorders, as well as allergies. Now, patient's primary concern was the inability to sleep in conjunction with his ADHD medicines. His current medications include Astaris once daily for ADHD. We can see statistically significant improvements in symptoms when we compare stimulants to non-stimulants when it comes to ADHD. Now, there are currently ongoing studies for Astaris in adults, and this is measuring the efficacy in stimulant-naive patients, or those who have not taken it before for ADHD, to determine the effect of the drug in the evening. Now, one of the touted benefits of Astaris is the taper of effect as we get into the evening. That trial has not concluded, nor will it be comparing it to other stimulants, so we really lack that data. However, one of the drugs that certainly does mimic the half-life as well as the levels in the body of Astaris is lisdexamfetamine, or generic Vyvanse. Now, studies have not shown any improvements of lisdexamfetamine over other stimulants when it comes to adults with ADHD, but we do have studies of simulated workplace environments that do show about a 14-hour duration of the lisdexamfetamine. Now, given the sizable cost of the Astaris, the lisdexamfetamine would certainly be a comparable substitute that should give comparable efficacy, as well as mimic the half-life and duration of the Astaris. So what is the plan going forward? We're going to discontinue the Astaris. We're going to initiate lisdexamfetamine 30 milligrams daily and titrate as needed. We'll monitor symptoms and efficacy at each monthly follow-up. We will continue the trazodone 50 milligrams at bedtime with potential to de-escalate therapy as much as possible, with the hope that the lisdexamfetamine effects taper earlier in the evening and the patient does not require the trazodone with as much frequency. So what do the costs look like? We should see no changes in the trazodone, montelukast, or sertraline, because we haven't made any adjustments to them. Now, when the lisdexamfetamine did go generic from Vyvanse, we were seeing very, very low costs on it. Now, that has gone up with a lack of availability, so we would expect somewhere around $740 a year. What do the savings look like? The savings on the Astaris, the pre-rebate number is around $4,700 a year, and the post-rebate number is somewhere around $3,000 a year. So what's the total difference? The pre-rebate number is about $4,000 in savings, and the post-rebate number is about $2,250 per year. Now, as always with rebates, they can fluctuate, depends on who's negotiating them, how much the PBM is withholding, and certainly depends on the medication class. Thank you guys so much for tuning in. Don't forget to like, subscribe, and follow us on LinkedIn.